Germline mutation in predisposition genes in pediatric cancer. Definition: every cell in the body has a system that controls its growth, interaction with other cells, and even its lifespan. When certain cells lose that control and grow in a way that the body can no longer regulate, it's called cancer. However, childhood cancer comes from random mutation in the genes of growing cells because these changes happen randomly and unpredictable. There is no effective way to prevent them.
What is cancer and how does it start? Hi, I'm Dr. Anthony Komaroff. Every one of us is made up of cells, trillions of them. Cancer begins when one cell starts to grow uncontrollably. Cells grow by dividing. One cell divides into two cells become four cells, and so on. Healthy cells divide only when they need to. Cells must divide for a baby to grow in the mother's womb, and then after birth to grow into an adult. Even after we become an adult, cells must divide to replace old or damaged cells. Normal cells divide in a controlled way, just when they need to. Cancerous cells, on the other hand, divide uncontrollably. Here a cancerous cell, colored green, starts to divide and it keeps dividing. The rapidly dividing cells push aside the healthy cells around them. They form a small cancer that at first is too small to see and then begins to grow beyond the organ where it started. What makes a cell turn cancerous and divide uncontrollably? Cells divide when their genes tell them to. But if a gene has a mutation, it can tell a cell to divide when there's no reason for it to divide. Most cancers start because of mutations in several different genes. When a cancer starts, the body's immune system will often recognize the cancer cells as abnormal and attack them. This may kill some cancer cells, but it can't get rid of all of them. To have the energy to keep growing, the cancer needs a blood supply. To get that supply, the cancer sends out chemical signals that draw blood vessels to it. Unfortunately, these vessels allow cancer cells to spread to other parts of the body. Some early cancers stop growing and never spread. These are called benign tumors. However, many cancers invade tissue around them and spread to other parts of the body. These are malignant cancers. To learn more, see the video called How Cancer Spreads. From Harvard, I wish you good health.
Application in medicine. The prevalence and spectrum of predisposing mutation among children and adolescents with cancer are largely unknown. Knowledge of such mutation may improve the understanding of tumor genesis, direct patient care, and enable genetic counseling of patients and families. Pros. Of the 58 patients with a predisposing mutation and available information on family history, 40% had a family history of cancer. Cons. The most commonly mutated genes in the affected patient were TP53, APC, BRCA2, and F1, PMS2, RB1, and RUNX1.
Helping your child cope with cancer-related pain is a focus for parents. Figuring out how to talk about it, where it comes from, and what it means are all important parts of the puzzle. Medication is at the heart of good pain management. Using medication as directed by your healthcare team will help your child have the best possible quality of life during their cancer treatment. And combining medication with other pain management strategies like distraction or deep breathing makes cancer-related pain better. Your child's healthcare team will answer your questions and help your child get through painful treatments. Talking openly with your healthcare team every time you have a question or concern is one of the best things you can do to help manage your child's cancer-related pain.
Issue in Ecuador. In our country, the rate of incidence of childhood cancer in Solca has been in the year 2009 83 cases and the year 2011 90 cases.
Cuando corres, sientes que el corazón se te sale. Te cansas, te mareas y sigues. Te preguntas cómo llegar a la meta. Pero yo no estoy cansado porque corro. Tengo un cáncer y mi meta es sobrevivir.
Este 25 de junio participa en la carrera 12 horas de amor relevo por la vida. Con cada vuelta que das al Parque La Carolina recaudamos fondos para construir el albergue para niños y adolescentes con cáncer, una iniciativa de Asonic.
Conclusion. Germline mutation in cancer predisposition gene were identified in 8.5% of the children and adolescents with cancer. Family history did not predict the presence of an underlying predisposition syndrome in most patients, funded by the American Lebanese Syrian Associate Caritas and the National Cancer Institute. Thank you.